some of the updated guidance and messaging on what to do if you think you have COVID or what to do if you have been exposed to COVID. So case and contact management is kind of that technical term that we've been using at the health unit. The difference between now and a couple months ago is that the health unit or our staff aren't the ones that are going to be doing case management and contact tracing for your average community case. At the health unit, our focus is on high-risk settings and outbreaks. I think across the province, there's no health unit that has the capacity to do the case management and contact tracing for us. We're receiving more than 100 new cases per day. So essentially what is happening right now is that when we receive a positive lab report, we screen it, we determine whether or not it's someone from a high-risk setting or associated with an outbreak. If it is, we hold on to it, we do the follow-up, we connect with the facility, we assist with contact tracing. If it's not, then it gets forwarded to the provincial workforce, which is a provincial supported system that will do the follow-up. For individuals that don't have access to PCR testing, there is no requirement to report that to public health. So if somebody has a positive rapid antigen test at home, there is no requirement to report that to public health, and there's no mechanism to do that. We know that that means our surveillance numbers are not accurate to the sense that they're reporting every single case of COVID-19, but I think they are certainly realistic in terms of the higher risk settings and vulnerable individuals to more severe disease, which is really where the focus has shifted to. So if you're an average community person, you don't work at a hospital or a long-term care home, and you are fully vaccinated, and you do not have another medical condition that is interfering with your immune response, and you have symptoms consistent with COVID, or you test positive on a rapid antigen test, the direction is to isolate at home for 5 days. And not just you isolating at home, but everyone in your household is also required to isolate at home with you, regardless of their vaccination status. So that's different from what it was about a month ago. If that person is not vaccinated, or if they have another medical problem that means their immune system is not as strong, then the requirement is to isolate for a full 10 days as opposed to 5 days. A couple of additional changes for those people that test positive or suspect that they have COVID-19. It's the I think collective community ask, since public health units are no longer doing this, for them to reach out to anyone that they have been in close contact with in the 48 hours prior to when their symptoms started, and let them know that, now I'm sick, and you should be watching for symptoms as well. Those high-risk contacts that don't live with the individual don't need to isolate at home, but we would ask them to be self-monitoring, so really watching for any signs or symptoms. I think the guidance around this is continuing to evolve, and we're trying to ensure that all of the resources we have available on our website are up to date, and hopefully are clear for different scenarios that we know people are facing. Our call center is able to answer questions about it. I know that our call center is receiving a high number of calls, and so sometimes there might not be as timely a response as people would like. But if you're not able to get an immediate response through the call center, certainly on our website is lots of information about what individuals and families should be doing.